I'm Lynn Bradshaw. I'm at the Roche-Posay Skinchecker here in Vancouver. Can you please introduce yourself?
Sure. I'm Jasmine Sang. I'm the product manager at Roche-Posay in charge of Anthelios.
Can you tell me a bit about what you're doing here today and about your dome?
For sure. So what we're doing today, the Skinchecker campaign, is about sensitizing people on the awareness of skin cancer. And what we're trying to do is offer free mole checks as part of our commitment to fight against skin cancer and teaching people the methods on how to detect that.
How has it been going so far? What has been the reaction from the public?
Yeah, it's been going very well. We have a lot of people coming by asking about our program, and a lot of people would love to see a dermatologist but not necessarily get an appointment. So we've been offering free mole checks for the past 3 days with Dr. Christina Han, and we've been able to book appointments right on the spot and offering free mole checks to these people.
How can other dermatologists get involved in this?
It's something a campaign that we've launched internationally and also in Canada as well. So we are having our medical reps, for example, visiting our dermatologists, giving them all the information that they need to share with their patients on the detection method. Because as we know and as dermatologists know, 90% of skin cancers are curable if detected early, but unfortunately the general public doesn't know that.
And how long have you been here at this particular site?
We've been here since Tuesday, so today's our last day. But like I said, we've been offering free mole checks, and then we've been offering samples of sunscreen to people as well.
Where's your next stop in Canada? Is this it, or?
This is it. Yeah, we started in Montreal in April, and then we were in Toronto during Melanoma Day with Dr. Sonia Cook, and then we're here during Sun Awareness Week in Vancouver, of course, doing this event, and this is our last stop.
Okay, well, thank you so much for your time. This is excellent.
Thank you.
Can you please introduce yourself?
I'm Dr. Christina Han. I'm a dermatologist in the city here, and I actually practice in New Westminster and in Vancouver.
Can you please explain to us what you are doing here today?
So today we're actually trying to promote some awareness with regards to having people be a skin checker. That can mean whether or not checking their own skin or having promoting their loved ones from getting their skin checked as well. So teaching them about how to check their skin and what to look for with regards to lesions or moles that may be changing, that may warrant further monitoring with either a physician or a dermatologist.
What has your experience been like so far?
So far it's been really positive. I've been getting really great feedback from just the public and the traffic that's been coming through here. We've had a lot of people that work in this vicinity come in for their skin checks and wondering about some of their moles, and have had even brought in some family members because they wanted to have their moles assessed as well. We've had some, most of the time, fortunately, it's been just regular mole checks that I can reassure the patients. And there's been a couple that have been a little bit more worrisome, requiring further follow-up. So I do think that it's been overall a very positive experience from patients and from the general public here.
Can you please share with us the takeaway message for dermatologists?
So I think it's great that there's dermatologists all over the city, but unfortunately there isn't enough of us. So I think having public message campaigns like this is nice, because as dermatologists we can tell our patients that these sort of events exist, so that we can educate patients, maybe on their way in for a commute into work, or if they're running errands, or meeting a friend, that these kinds of events exist. And actually, not just today, but the Canadian Dermatology Association runs free public skin checks annually as well, and that's free for all Canadian residents, and they pop up all across the country. So there are events like this that this Canadian Dermatology Association also promotes as well.
So what is the take-home message for consumers regarding sunscreen or melanoma prevention in general?
I think generally, especially when we have great sunny days like this, sun protection is a common question I get. So definitely making sure that good sun protective behaviors are employed, like a wide brim hat, sunglasses, and clothing are definitely very important physical barriers. Certainly things like sunscreens are important, especially with periods of prolonged sun exposure or sunny destinations. So I definitely recommend a good UVA and a UVB sunscreen to be applied every 2 hours and at least an SPF of 30.
At what point should people decide to have their moles checked?
Essentially, I think their moles should be checked with their family doctors as part of an regular physical examination. And if the family doctor or family member or the patient themselves are concerned or wondering about any moles, then certainly that's where I think it's reasonable to have a referral to a dermatologist or even to your family doctor to see if they can assess your moles for further investigation.
And can you provide us with maybe some tips for the general practitioners?
So I think as a general practitioner, I think there's a lot of opportunity there to counsel patients on good sun protective behaviors, especially during summer months, and especially to start early, because I think it's really exposure in childhood and early years that can actually cause a lot of this subsequent damage decades later. So early prevention and encouragement of good sun protective behavior, I think, should be key points for family doctors.
Thank you so much for your time today. Appreciate it.
You're welcome.